Hi, Ms. Jones. How are you today?
Good, how are you?
Good, thank you. My name is Lindsey, and I'll be your OT for the day.
Okay.
Your doctor has ordered an OT evaluation so we can address some of the symptoms you've been experiencing and help you get back to the things you want to do.
Okay.
I read over your chart, and I see that you suffered a stroke during your recent cardiac surgery, and it's affected your left arm.
Yeah.
Okay. Because of your surgery, there's a few precautions that I wanted to talk to you about.
Okay.
Are you aware of your external precautions?
Not really. Don't know
Okay.
what it is.
Well, I'll go through a few of them with you.
Okay.
We don't want to do any heavy lifting. That's number one. No pushing or pulling motions, like when you're getting in and out of bed. No flexing or extending your shoulder past 90 degrees, so only up to here.
Okay.
And same in the back. Nothing like up here.
Okay.
For right now. No twisting or deep bending motions, or no over-the-shoulder activity, like trying to get your jacket on or put your button-up on, sweater.
Okay.
So nothing like that right now. And last, you'll want to brace your chest if you feel like you have to cough or sneeze. So if you have a pillow nearby, grab a pillow, put it over your chest, or just kind of hold your hands close to you. So those are your external precautions. Do you have any questions for me?
I think I'm good.
Okay. I also see that you are on the nectar consistency liquids right now. Okay, so you're aware of that. Good.
Yes.
And the last thing I wanted to go over with you is that once we start doing some activities and I'm standing you up, you could start to feel some lightheadedness or dizziness, which is normal for someone who's been lying in bed for a period of time. So if you start feeling like that at any time, let me know and we'll stop. Okay?
All right.
Okay. I'm just going to kind of talk to you about your living situation, and I see that you live with your husband.
Yes.
You guys have a first floor condo, correct?
Yes, correct.
Okay. Is it a single level? Like, does it have an upstairs?
Yes.
Okay. And there are no stairs inside that I should be aware of?
No stairs.
And does your husband work during the day, or would he be available during the day to help you if you needed?
He works during the day, in the week, and then on the weekends he's completely free.
Okay. So he'd be available during the week, during the evening?
Yes.
Evening time? Okay. Okay. I'm going to ask you about your pain. On a scale of 1 to 10, with 1 being no pain, 10 being the worst pain you've ever felt, how do you feel right now?
I think it's about a 5.
I'm just going to have you do some motions for me so I can see your range of motion on your right arm. Can you raise your arm out in front of you like this? Head to the side, and then back down. Okay, any pain with that?
No, not really.
Can you show me how you'd wash your hair?
Maybe like this.
Okay, good.
Okay.
And then I'm going to test your strength in that arm.
Okay.
So, hold it out here for me.
Okay.
And I'm just going to push down, and I want you to resist my movement. Can you do this motion for me?
Yes.
Okay, good. All right, so hold. Don't let me move you, okay? Don't let me move your arm.
Okay.
Good. Okay. This. Can you do this motion for me?
Yes.
Any problems with that?
Mm-mm.
Okay. So same thing. I'm going to push, and I want you to hold. Hold. Don't let me move you. Good. And I'm going to pull you this way.
Okay.
So hold. Don't let me move you. Good. And then grip my finger. Good. Everything seems normal. I'm going to show you a piece of paper that has letters on it, and I want you to tell me what the letters are so I can test your vision.
Okay.
Okay. Are you able to read these?
What is it?
No?
No, I can't see
Okay.
that.
They're letters. They're pretty big.
Oh goodness. Yeah, I can't.
Have you had any history of any eye issues?
No, I haven't, but
Before the stroke, did you have issues?
not before.
Okay. Okay. Make note of that. Can you tell me what day of the week it is?
It's the 11th.
Okay, and what's the name of the place that we're in right now?
We're in my hospital room.
Yep. Okay, good. Just to kind of go over what I wanted to do with you, what I want your goals to be, I want to work on strengthening that left arm and kind of working on your hand function in that arm, trying to regain some of that back so you're able to complete your self-care tasks, because I know you were independent with that before this happened. I also want to work on your endurance, because I know that you've been getting short of breath during your activities like dressing and bathing. So we're going to work on some endurance activities. And then I wanted to work on coordination of your arms.
Okay.
So those are kind of the 3 things I want to focus on. So starting tomorrow, I'll plan on seeing you early in the morning, probably right after breakfast, so we can maybe work on getting dressed. I can help you, and if you wanted to take a shower, so we can work on that in the morning. So that'll start tomorrow. But while you're in your room by yourself, outside of therapy, there's a few things. It's one thing I could suggest while you're just watching TV, having some downtime. Practice buttoning and unbuttoning one of your shirts, and try to use that left hand as much as you can. Kind of have your right hand hold the shirt and try and manipulate the buttons as best you can. This is outside of therapy, just to kind of give you some homework to do.
All right.
As far as everything else, I'm going to talk to your nurse and tell her that your constipation isn't getting any better, and see if there's anything else she can give you instead to kind of get that moving, because I know it's been a few days. So, then talking about discharge, as far as that, a couple things I would recommend equipment-wise for you when you go home is a dressing stick to help you. It's like a long stick, has like a hook, well, some of them have a hook on it. A sock aid that'll help you get your socks on, a little easier, and possibly some utensils that have some built-up, thicker handles. That would be easier for you to grasp with your left hand, just for right now while you're trying to gain back some strength and mobility. And I would make a recommendation for you to possibly see an optometrist due to your vision issues earlier. Couldn't see the letters. Maybe get that checked out, since you weren't having problems before the stroke. Might be something to look into.
It's a little worrisome.
And once you're discharged, I think that you should continue with outpatient OT. I think that would be appropriate and would benefit you. So do you have any questions for me?
I think that's everything.
That's everything? Okay. Well, nice meeting you, and I'll see you tomorrow morning.
All right. Thank you.
You're welcome.